Hello, my name is Julie Jung, and I will be doing a health assessment on you. I'll try to keep it brief, but if you can answer these questions to the best of your abilities, could you please provide me with your name
Chelsea Bratton.
and your age and date of birth,
I am 24 and my date of birth is May 16, 2001.
and your address?
818.
Cool. And your preferred pronouns,
She, her.
and your ethnicity,
Hispanic.
sex assigned at birth,
Female.
your gender identity,
Women.
and your education level.
Bachelor's degree.
And what is your current occupation?
Nursing student.
Alrighty. Okay, so I'm gonna get started on your health history.
Mm-hmm.
Any allergies?
So, when I moved to UC Davis for my undergrad degree, I wasn't aware of how allergic I was to many substances in the environment. Decided to get an allergen test where they poke your back. I'm sure you know what it is. I am quite allergic to lots of things. At the top of my head, trees with white trunks, eucalyptus grass, peanut butter, lots of things. So basically, survival of the fittest, I would probably not survive.
Okay. Okay, now how does it make you feel when you do consume peanut butter or you are near?
So with peanut butter, I don't need an EpiPen or you to call an ambulance. Sometimes I do risk it and eat a Snickers every now and then because I think that it's worth it. But I get so bloated that you would think I'm 9 months pregnant, and I physically cannot move until the bloating goes down because of how painful it is.
How long is that typically?
A couple hours.
Okay.
Depending on how much peanuts I've ingested. A Snickers.
Like a Snicker.
One
Like
Snicker
a Snicker bar
would probably be like 2 hours, and I would have to lay down and like not move.
So like 2 Snicker bars
would be probably
4 hours. Okay.
Yeah. So gotta be.
Alrighty, but nothing in the throat.
Nothing in the throat. Itchiness in the throat when I do drink soy milk. So I am allergic to soy milk.
Okay.
A lot of itchiness. And I'm not certain if, because I'm allergic to soy milk, I should also stray away from soy sauce. But I don't. But soy milk definitely makes me feel like my throat's closing up.
Okay. Couldn't give you the answer to that at the moment, but I'll ask your provider.
Thank you.
Alrighty. Okay. And are you currently feeling any pain?
At the moment, I am feeling menstrual cramps. Right before this health assessment, unfortunately, I got my period. And back pain and breast pain, soreness.
Okay. You said currently. Right. Anything else?
Not at the moment.
What seems to make it better or worse?
Laying down, sleeping, taking Tylenol sometimes helps. But I also don't want to take Tylenol every month when I get my menstrual cycle. Because GERD is something else I struggle with.
Okay, we'll get back to that.
Yeah.
Okay, I know you said it just started today before this assessment, but has it affected your ability to perform any ADLs, meaning daily activities?
I don't let it affect me.
I appreciate your mentality.
I always push through the pain. I would say, compared to other women in my life, my menstrual cycle is definitely heavier with heavier symptoms. But I don't let that keep me down. Because according to other providers that I've seen, it's normal.
Oh, so you've asked your provider, they said
normal.
The amount. Okay.
The amount of symptoms and the heightened pain I feel, or the amount that a fluid that comes out of me is within normal parameters.
Within defined limits. Okay, so other than telling you to take maybe some Midol or Tylenol, those are the only treatments recommended?
Yeah.
Okay. For your past medical history, do you have any health issues or hospitalizations as a child? Or actually in your adulthood as well?
As a child, I did have to have some hospital, like ED visits. One was when I was younger, I was running on a treadmill with my cousin, and she pushed me, and I fell off the treadmill, and I burned my skin.
Do you remember what degree?
I do not remember the degree because I do remember I was young, but I did have to stay in the ED for a while. I think I even had to stay a day because the burns were like all over my body and my legs.
On the right side?
Just everywhere, both legs and my stomach. And then again, had to do an ED visit because during high school, I was playing basketball, and I would assume that the other team forgot that we were playing basketball, and maybe she thought we were playing football, and she tackled me. And
in basketball,
yes, and she tackled me so hard that I fell to the ground, and you could just hear my head go. And I had to go to and I had a concussion. And as soon as when my head hit, my coach tried to stand me up, and I immediately fell back down because I was just so disoriented and dizzy. And yeah, it turns out I had a concussion, and I couldn't play for 2 weeks.
Okay, I'm sorry to hear that.
That was my child life. In my adult life, I unfortunately had a ganglion cyst that was affecting my range of motion on this.
Could you show us?
This current wrist. This is the scar. Which is interesting enough because up until the cyst started to become visible, I thought I might have arthritis because of how the pain. Once I had surgery to remove it, the surgeon informed me that she thinks that it must have been growing for years because of how deep implanted it was in my wrist, and how much larger it was than the scan.
Could you show us diameter, how big it was?
I wish I could have kept it, but it was like this.
That's pretty big.
And then I'm sure it was bigger because it was indented inside of my wrist.
I'm happy you sought help instead of hitting it with a textbook.
Yes, some people like to refer them as Bible cysts.
Yes.
Yeah, so you actually shouldn't do that because the fluid can leak everywhere and it can cause an infection.
Yes, good job. Have those issues caused any chronic conditions?
I would say that the range of motion on this wrist is limited now.
Okay.
And it's not as strong as it was before, but my pain has definitely improved.
Okay.
I do have scars from the burning of just like the burn of the treadmill. As opposed to concussion, I think I'm good.
Okay. All right. Moving on. Are you up to date with all your vaccines, including COVID, flu, shingles?
Yes, except I guess I don't know if this is considered up to date, but I went to the doctors recently and they asked me if I wanted a COVID vaccine, and that would be my 6th one. Okay. So I declined.
Okay.
Because from my knowledge, I have not had COVID.
Okay. Wow. And sorry, going back to your range of motion, any recurring symptoms or problems that you are currently having?
I would say just my wrist. Like when I go to the gym, it's definitely weaker. My grip isn't it was already not very strong, and I just feel weaker. Okay. Nothing else.
Alrighty. Anything else you want to add to your surgical history other than your ganglion cyst removal?
I have had some dental procedures done as well. I had a tooth removal. I can't remember when. I remember being young though. I probably was 12 because I remember the orthodontist who did it was like, I've never removed a tooth or done a root canal on a person this young before, and that wasn't very comforting to hear before.
Yes, dental hygiene, very important. Okay, then moving on to your family history. Do any of your immediate family members have a history of chronic illnesses?
My mom and my aunts, like my maternal extended family, have a history of high cholesterol, as well as my maternal grandmother. She had ovarian cancer, but she is a survivor. You would have never thought. Didn't even lose any hair during chemo. I'm not really sure in regards to my biological dad because he's not in the picture, but my stepdad does have diabetes, but that doesn't really affect me, I guess.
Okay. And just because you did bring up like your parents, are all your parents living? And you told me their health conditions, but
To my knowledge,
yes.
yes.
Okay. Okay. And do you have any siblings, and what are their medical?
I have 3 younger brothers, all in good health. I would say no problems there. But because they're my half siblings and my stepdad does have diabetes, I do often remind them that they have to be extra careful about the food that they consume and their activity level, so that they don't develop diabetes in the future.
You're a great sister.
I know.
I'll be going through each system very briefly if you can answer these to the best of your ability. So generally, any changes in your weight, fatigue, fevers, or night sweats?
I would say that my weight does fluctuate. I think that there's periods in time that I do watch what I eat, try to eat healthier and work out, and then there's times where I really do not care because I'm so tired and overwhelmed with school that I kind of just eat whatever I want and not exercise. I will also say that ever since I've been off birth control, I have lost a tremendous amount of weight unintentionally, like unwilling, like not trying to. I'm not upset about it because I did want to lose it, but I will say any type of birth control, because I've tried numerous ones, have made me gain weight and my face break out tremendously.
Okay, so you're currently not on any
Currently not. I have an appointment with a gynecologist because I do want to put a copper IUD in.
Okay.
But because I have Medi-Cal, it's everything just is a little bit slower.
Okay.
So still awaiting that call to schedule the appointment.
Okay. Actually, because you did mention it causing a lot of like facial flare-ups, do you experience a lot of breaking out, like acne now, and are you on any medication for that?
I feel like recently I was breaking out a lot, but today I got my period, so I feel like that's probably the reason.
Yes.
Prior to I did break out a lot as soon as I hit puberty. It was something that I struggled with a lot. I was told that it was probably because my biological dad has like adult acne, and honestly I tried everything, and the only thing that really helped my acne was when I finally went to the dermatologist and tried everything until everything didn't work, and then I tried Accutane, and that really cleared up my acne.
Okay. Awesome. Alrighty. And now, any headaches, dizziness, or neck stiffness?
No.
Wonderful. For your eyes, do you wear glasses or contacts?
I do not. I have 20/20 vision.
Any vision problems like blurriness, halos, or floaters, though?
I only feel that way, I think, after just like a long day of looking at a computer screen or staying up late studying, but not usually. Okay, great.
And for your ears, any hearing loss, ringing, or ear infections?
No.
Do you use hearing aids?
I do not.
For your nose, mouth, and throat, any congestion, nosebleed, sore throats, or dental issues currently?
Currently, I do think that I have a cavity because I was eating chocolate the other day and my tooth was hurting. Congestion, I feel like as it's getting warmer, maybe there's more pollen in the air. So I've had to take an allergy pill every now and then. I do think it would be more beneficial with me if I was more consistent with it, but I definitely am not. So sometimes I do get congested in the morning or at night. I'm just sneezing, or as soon as I wake up, my throat is hurting, but it goes away. So I'm confident that it's just my allergies.
Is there a certain allergy medication that you prefer, choose to take?
So my doctor gave me Zyrtex. So I just use that because it's free. And
great. How's your sense of taste and smell?
Good.
Amazing. Now moving on to your respiratory system. Do you have any shortness of breath, coughing, or wheezing?
Sometimes if my allergies are a little bit too much, I do cough, but no wheezing. Nothing else.
Actually, yeah. When was the last time you recall being sick?
I don't remember. It's been a long time.
Okay, so no respiratory infections recently?
No respiratory infection. I think because of the fact that I have 3 younger brothers and I'm just surrounded in an environment with children and constant germs growing up, my immune system is very strong. I could be in a house full of sick people and be the only person who's not sick.
Okay. Okay. I mean, you said you don't recall ever having COVID, so.
Yes, I really, even though everyone in my house had COVID, and then I took a test, everybody but me was positive in my household of 6.
That's incredible. Moving on to your cardio. Any chest pain, palpitations, or history of high blood pressure or heart issues?
So in college, when I was at UC Davis, I thought I was having a heart attack because I was having chest pain so strongly that I could not move. I went to the emergency department and I was told that I have GERD.
Okay.
So I guess
it was
just very intense heartburn.
Okay. So that was in college. It's been a couple years since you're out of college. Do you have those GERD? I mean, do you have those flare-ups now?
Occasionally, I do think that I have those flare-ups when I'm ingesting too much caffeine, eating too many processed foods. I have a flare-up every now and then, but it really is very horrible and uncomfortable. So I try not to eat so late before I go to bed because I know that can agitate my GERD. But I haven't had a flare-up in a while, maybe in a couple months. But there was one night during one of the more stressful sessions in this nursing program, because I am a nursing student, that maybe it was a combination of GERD and anxiety, but very bad, and I couldn't move, and I had to stay still for like 5 minutes.
Okay. Talking about flare-ups, do you swell in your legs or experience any type of swelling in your body more prominently?
Maybe on my period I feel more swollen and bloated, but not in any other situation or circumstance.
Okay. So currently any nausea, vomiting, constipation, diarrhea, or heartburn?
Currently I do have some nausea, but I think actually I realized that being nauseous is like a new symptom for me.
For your menstrual.
Yeah, during my menstrual cycle.
Okay. So it's temporary, it goes away, or do you feel like it's there the whole time you were on your period?
It comes and goes, I would say.
Okay. Let's talk about your bowel movement. Just tell me about it.
I have frequent bowel movements.
Okay.
I think I have about 2-3 bowel movements a day. On my period though, I feel like sometimes it can be more.
So like 14 to 21 bowel movements in a week.
Yeah. Right now, and it's like what, 3 p.m. I've pooped twice already.
Wow. Okay. So when was your last one?
Before we took our test, like 11 something.
11, okay.
After I ate some Blaze Pizza.
Any urinary frequency, urgency, pain, or incontinence?
I actually think that I suffer from UTIs frequently, like self-diagnosed. Like, I don't know. I try to urinate after sexual intercourse, wipe myself correctly.
What is that? What does wiping yourself correctly look like?
Not back to front.
Good job.
But, and even in the shower, I try to make sure that I don't use scented soap down there or soap inside, but I went to the doctor, and for some reason, because I got a urine analysis, they did the culture, and it turned, I don't know, they couldn't do it. It said inconclusive. Okay. But I was considering going again because I feel like my urination, sometimes it could be smelly, but then it's also smelly after I drink coffee. So I don't know if the coffee, there's just like so many
factors,
but I do think that sometimes I have more urination frequency, and I know it's not pre-diabetic because my A1C is 5.1.
Good job. And how old were you when you first started your period?
I was about 13, 14.
Okay. Are they regular?
No, my periods are very irregular. Sometimes I'll get my period twice in a month. My cycles can range from anywhere from 20 to 32 days.
20 to 32 days. Okay. Is there any chance you could currently be pregnant?
No.
Okay.
I'm on my period.
You're correct. Trick question. Moving on to musculoskeletal. Any joint pain, stiffness, swelling, or back pain?
Well, currently, because of my period, I do have back pain. And then, like I mentioned before, my wrist. Nothing else.
Do you feel physically limited in any way because of your menstrual cycle?
No.
You usually work out continuously.
I try not to work out as vigorously while on my period, because I also have learned in nursing school that it's not the most helpful thing for my body or myself to exert myself so much when I am
during certain phases.
During certain phases.
Yeah. For sure.
So I try to do more of a light workout. I do think that it's so important for me to move around. So.
Okay. And then any numbness or tingling, dizziness, weakness, or memory issues?
No.
Amazing. All right. And how is your mood generally?
Generally, I would say I'm pretty patient and up spirits. I say patience because I feel like I am juggling a lot of things in my life at the moment. I will say sometimes I'm more moody than other days, or I'm more tired and quiet than I am usually, but overall I would say my mood is good. I'd give myself a B minus.
Great. And have you experienced depression, anxiety, or trouble sleeping?
I wouldn't say depression. I've definitely had some low moments because of certain situations happening in my personal life. Also school. I think I love academic validation, and failing classes really affects my mood, especially failing exams in the nursing program.
So have you sought out professional help?
No, I haven't.
Okay, so for that, are you taking any type of medication?
No.
Okay. Do you take any over-the-counter medication?
So I recently went to the doctor and I found out that I was vitamin D deficient. So I have been taking vitamin D. And since I'm trying to keep up with my vitamin D, I realized I have all these other vitamins that I haven't been taking. So I've decided to take them with my vitamin D, such as vitamin A, NAC, I don't really know what that is, fish oil, and B12.
Great. And could you just quickly walk me through an average day of yours and try to include your meals as well?
Okay, great. Wake up, depending if I have school that day, 6:30. If I can sleep in, I will sleep in. I don't usually have breakfast. Maybe like a banana or an apple and coffee. Head to school, sit in class, do homework in class or take notes, eat lunch, usually go out to lunch with my nursing friends. I wouldn't say that our choices are always the healthiest. Go home, probably have a light dinner. I'm not typically hungry by then. Go to the gym. If I don't have time to go to the gym, it's usually because maybe I have other plans. And then I go home, sleep. That's my typical day.
Would you say you're satisfied with your diet, your exercise, and your sleep regimen?
No. I wish I could sleep more. I think my sleep schedule is inconsistent and not reliable. I feel like it varies every day. Eating, I feel like I could be a healthy eater for a couple days and then I will not be consistent with it. And exercise the same. I can be consistent with exercise and then I'll fall off.
Okay.
So I really want to do better about balancing that all out.
Okay. So based on all that, how do you feel about your health and your body overall?
I'd give myself a B+, because as I mentioned, I recently went to go get my labs done, and everything but my cholesterol, my HDL was high, slightly elevated. It was like 209, and 200 is the but my LDL was also very high, so maybe it cancels it out.
LDL is the bad one.
Oh, then the other way.
Yeah.
Then my HDL was high.
Yeah. Okay.
No, I think I'm right.
LDL is the bad one.
Okay.
We'll come back. Okay. Do you drink alcohol or partake in any substance use?
Occasionally I do drink alcohol. Substance use, no.
Okay. Alcohol, how often do you drink?
Maybe in a week 2-4 times. Actually, 0 to 4 times. It could really
0 to 4 times.
It could really range. Like there could be weeks where I drink absolutely no alcohol, and then there'll be weeks that'll be 4 out of the 7 days I'll drink alcohol. I think it really depends on how heavy my week is.
Okay, so in terms of the coping, are you religious or spiritual in any way?
I am religious. I am Christian. I think that I enjoy going to church on Sundays. I think that my beliefs have really helped me manage and deal with school, my life, and just everything. I wouldn't necessarily say I'm spiritual, but I do have a relationship with God, and that's very beneficial for my spiritual and mental health.
Awesome. And in terms of like benefiting yourself, or you said you rely on God, also do you rely on the support of your family, friends, or a counselor maybe?
My family and friends for sure.
Awesome. Is there anything else that you'd like to share about your health, lifestyle, or history that we haven't covered?
I suffer from ingrown toenail a lot.
Okay, but you got no surgical.
I forgot to mention that. I got it partially surgically removed, and it just grew back. So
so currently you're experiencing pain there.
Yeah, I actually dug it out myself, and it's okay now. But I've definitely considered taking the whole nail off considering how bothersome it is.
Okay, thank you for letting me know. I'll write that down.
Yeah, but that is all. Thank you.
Okay, thank you so much.
Thank you.
Have a great day.
Thank you.